Hi, I am Dr. Hanmant Reddy, Consultant Intervention Cardiologist, Care Hospital, Banjara Hills. Today we will discuss about most of the people will be asking what are the tests they need to know whether they are about to get heart attack in the future and what are the tests they need to take as a precautionary measure. What are the tests you need for a cardiac evaluation? Most of the times any patient who has crossed above 40 years or 45 years, when you are having any symptoms means you are having chest pain on exertion while walking, breathing difficulty on climbing stairs, you require a further evaluation. The test you need to know further, any patient needs to know a complete blood picture. We wanted to see how much is your blood content hemogram and your kidney function creatinine test and associated chest x-ray if any other lung infection is ruled out. Once it is done, you need to do an further ECG because you are having a chest pain on exertion or breathing difficulty on exertion. And once it is done, echo will be done to see how the heart function is, how your valves are functioning. Once ECG, echo are normal, if the patient is physically fit, if he is able to do a treadmill, important things is we will do a treadmill test because we may think less than 40 years if there is a probability is low. If they are able to do an adequate treadmill, if there is no symptoms while doing treadmill, there is no ECG changes, there is no drop in the blood pressure, we usually think the treadmill test is TMT is negative and the patient we can able to say your heart is fit, you can do your regular activities. Some of the patients who are unable to do a treadmill test because of various joint problems or other issues, in this if there is probability means having of a coronary heart disease will be depending, we will assess if their associated risk factors are there. If the patient is having diabetic, hypertension, any other family history of a heart problem, if we think this is a high probability, if patient is symptomatic, we will directly do a coronary angiogram. Coronary angiogram is done after admitting the patient in hospital, whether through a radial route or a femoral route, and we will assess how the arteries are there to your which are supplying to a heart. In some of the cases where you feel that there is a low probability, without any admission, if your creatinine is normal, your kidney function is normal, we will do a CT coronary angiogram, where itself it will give us a good anatomy, how the supply of arteries are there to your heart, and is there any anomalous coronaries which is there having any anomalies are there. Once it is there, once you are diagnosed to have a coronary arteries in CT CAG, to completely make sure, we will also subject this patient to coronary angiogram. Once after doing a coronary angiogram, if blockage is very mild, we will keep them on a medications. If the blockage is tight, if any severe, where we will advise them on a stenting depending on their whether if you are able to do or not. In some of the cases, if the blockage is very severe, if the left main where the heart supplying where is starting of it is there, if any full calcification is there, if it is supplying all three arteries are involved, in that cases we may not able to do stenting because of a long-term prognosis, we will advise them to do a bypass surgery. Once the whatever it is done, you need to do a regular healthy lifestyle modification. You need to consume a good raw grains and fruits and vegetables, and you need to stop smoking if you are already there, and you need to control your diabetic and hypertension. You need to follow your doctor regularly and you need to take medications without skipping it, and once you need to monitor your blood pressure and kidney function test depending on the medications what you are using. Thank you.